If you do something that breaks that epithelial barrier inside your gut, toxins from your diet can go into your bloodstream and can be absorbed into your bloodstream.
Yeah.
And there's many things that can cause that epithelium barrier to become disintegrated, to cause that leaky gut. Today we're specifically going to talk about something that Andrea has a lot of experience with as well, and that is leaky gut.
So I think if I can ask the first question, I guess one of the big topics is I've had leaky gut, and I think it's something that I will maybe always struggle with. But what is leaky gut? I'm sure that people want to know what it is and how does it start, and what is the terminology leaky gut?
Okay. When I got first introduced to the whole principle was in South Africa. We motivate mums who are HIV positive and who has AIDS to still breastfeed their children, but to exclusively breastfeed, not to do anything else. Because we found that if a mum breastfeeds only, that gut mucus stays intact. And the HIV virus does not get transmitted from the mother's milk into the baby's bloodstream. So it goes into the gut, but the gut is so intact from being breastfed only that all the harmful viruses get excreted again. But then once you introduce even just one bottle of formula or food, that impairs the integrity of the gut, and then the baby can get HIV from mother's milk. So in Canada, typically, when kids have HIV or when women have HIV, we say not to be breastfeeding their kids. But in South Africa, it's trickier because your risk, if you are bottle feeding your baby, you have that risk of becoming malnourished if mom can't afford formula, or if the bottles are not sanitized correctly, that the baby can become sick, have diarrhea, and then die from dehydration.
Yes.
So they've done lots of studies and really found that your benefit of breastfeeding outweighs the risk. So they really encourage breastfeeding, but to do it exclusively for 6 months, and then the day you stop, the day your baby has its first bottle of anything else, that barrier, intestinal barrier of the epithelium inside the gut gets broken. And I'm not even talking about harmful pesticide food with toxins. I'm just talking about general baby formula, which is then irritating to the gut, causes leaky gut, and then if mom breastfeeds again, that virus from the milk can go through the gut into baby's bloodstream.
Wow.
So that's when I got introduced to it the first time. Then as a doctor working in a very big hospital, I would often have patients with significant gut symptoms. They'll have diarrhea, bloating, they'll come into hospital. We will be sure this must be Crohn's disease, ulcerative colitis. And then when we do go with gastroscopy, colonoscopy, we don't see the picture usually typically of inflammatory bowel disease, because people are on a spectrum. Some people will have that inflammatory bowel disease, some will have a perfectly healthy gut, but you have a big space in between. And I really found that my patients were very frustrated when they come to hospital. They have these symptoms, and we know they have the symptoms, and even when I do their blood work, I can see their gut is so inflamed, they're not absorbing iron, they're not absorbing nutrients from their foods. All the micronutrients, zinc, that I test for are low. They're not absorbing. Their gut is inflamed. They're having chronic diarrhea. But it's not in one of the 2 or 3 specific categories that we put people.
Yeah.
And my patients find it so frustrating. So I've done further training through the Institute of Functional Medicine in integrative medicine. It's 2 completely different universities where I did more training to really understand leaky gut and the whole spectrum in between. Fascinating world, and there's 2 different blogs on my website that you can have a look at, Wellness MD Health, that talk about it. But in summary, if you do something that breaks that epithelial barrier inside your gut, toxins from your diet can go into your bloodstream and can be absorbed into your bloodstream.
Yeah.
And there's many things that can cause that epithelium barrier to become disintegrated, to cause that leaky gut. One of the things is using antibiotics.
Yes.
When we use antibiotics, we kill off all the bad bacteria making us sick, but we kill off good bacteria as well. And there's so many bacteria in we call it our microbiome. It's like a whole new planet of bacteria inside of your gut. You need each of those bacteria to help to absorb nutrients from your food. When we kill off all those bacteria, we won't be absorbing other things toxins from our diet, eating fast food, fried foods, all these bad oils, cottonseed oil, palm kernel oil, all those things are harmful to our guts.
Yes. It's incredible. I remember being so sick, so extremely ill. I also eventually had to journal it. I wrote it down. I actually put it on my blog. It's just my story. But just trying to navigate what was wrong with me, the extreme tiredness, my hair was breaking off, and basically I was super malnourished.
Yes, because your body can't be absorbing.
I was passing food out whole. There was absolutely no absorption. And somebody who, like, I would like to think that I eat healthy and that I exercise and whatever. And one of the big key factors for me was antibiotics, for sure. So,
and it's hard for people because with this malnourishment, it's often easier for your body to absorb sugar than to absorb some of the other micronutrients. So a lot of people might not be losing weight. So if someone loses weight, then you can obviously see, yes, you are malnourished.
Sure.
But there's a lot of people who are at a good weight or even overweight because your body knows it needs something. So you're eating more and more to try to get those nutrients.
Yeah.
Your body is able to absorb the easy carbohydrates, easy sugar. So you're gaining weight. So you don't think you're malnourished. When you look in the mirror, when you stand on the scale, you say, I'm a good weight, so I must be good. But you can still be at a healthy weight, at an unhealthy overweight, and still be malnourished.
I had no idea. And I thought I was in tune with my body. And this was the first step for me to learn to start to listen to my body. Like, what is the time? Like, I would actually be driving and wanting to nod off and fall asleep. Now, you know me. I'm high energy, outgoing, everything. And that was the sign. I was like, I need to go home and sleep. This is not normal. This is not normal to eat. So I was so hungry all the time. Like, so all those things. Yes, exactly. So
it's leaky gut,
all right. So those are the symptoms. So who is at risk of getting the leaky gut?
So definitely people with autoimmune diseases would be at higher risk. People that undergo any type of cancer treatment, chemotherapy, would be at a higher risk because your epithelium generally has a high turnover.
Right.
So when we give cancer medication, we often kill off the high turnover cancer cells, but we also kill off those high turnover gut cells. And those are typically the people who come to me first, would be people who have undergone some type of cancer treatment and who recognize. People who are under high stress would often have it. Definitely diabetic patients. I see it very often in my diabetic patients that has that impaired ability to absorb from their gut.
Yeah. Is it true? I've heard that is it the epithelial layer? It's only one cell layer thick.
Yes.
It's like hard to think about it.
Yes.
And then also the whole thing about if you had to take your colon and roll it out, it's the size of like a tennis court or something ridiculous. Like it's actually has a massive absorption surface.
Yes. And then also if you look at the amount of bacteria, I don't even know on the top of my head, but there's like literally trillions of bacteria in your body.
Yeah.
So it's quite weird to think that you have all this bacteria, and it's critical for your mental health. 90% of our feel-good hormone, our serotonin, gets made by bacteria in your gut.
Oh, my
so
word.
when that gut system gets disrupted, we as doctors will prescribe you a serotonin reuptake inhibitor to keep the feel-good hormone that you have in your brain a little bit longer. That's what an antidepressant is. But that's only for the 10% that is there. 90% gets made new in your gut. So if you can just feed your gut the type of foods that encourages serotonin production, your mood will be significantly better.
And to that point, so it just makes you think all the time, every time I put something in my body, how is it benefiting me? Like, you're not helping yourself, right? If you keep doing the wrong thing.
Benefiting or harming.
No, it's crazy. So how do we treat leaky gut? Help us.
Yes. So there's a lot of things. First, we want to avoid toxins. You want to avoid any substances that you use that's illegal. If it's illegal, it's most likely it's making it worse. Alcohol is, if you consider that's what's in your hand sanitizer, alcohol definitely makes leaky gut worse.
Good point.
Right?
Yeah.
And then fast foods will make leaky. Say your diet. That's first and foremost is your diet, what you put in your mouth.
Yeah.
You want to put in all the good bacteria. So that would, you can take a probiotic supplement.
Okay.
If you don't want to go supplements, if you want to do it naturally, you get good probiotics in yogurt or in kefir. Kefir is a yogurt drink that you can buy in the yogurt aisle that has loads of probiotics in it. And if you are dairy free, you can also find it in alternatives. Kombucha has a lot of, so anything that's prebiotic, like pickles, sauerkraut, miso, tempeh, all those things will put prebiotics, probiotics in your gut, feeds all the good bacteria to grow better.
Amazing.
And that protects, that heals your gut, that protects you. So you want to put in things that heals your gut, and you want to avoid toxins. So some toxins are very obvious, like bagels, donuts, fried foods, anything that's fried.
Yeah.
Bad oils, processed foods. For some people, if you've avoided all the obvious toxins and you're still experiencing, it is often gluten, dairy, and sugar, and specifically sugar are often.
Yeah, and I mean, I remember feeling great doing keto for a bit.
Oh, and that's why.
And that was great. But then I was still getting this extreme bloatedness and pain in that. And then I was like, oh, because keto, you're taking in a lot of dairy, like so much dairy. And then, you know, this doctor said to me, listen, keto is great. And it's great for people that are trying to do something very specific, but everybody's body is different. And I was like, finally, yes, that's actually so true. I cut out the dairy and it changed my life. And I'd done testing. So it's like you talk about that microbiome of what's happening, that ecosystem. And I had 0 lactobacillus, which is one of them, I think, that processes milk products, like lacto. I guess that makes sense.
Yes.
Yeah. And obviously I just cannot process milk, but it changed everything for me. And it's just really, I think, understanding, seeing a professional like Dr. Steyn would be amazing, where you can say, where am I at? So it's like, I guess that's one of the ways, right? You could get tested, like you do different stool samples. Like, let's talk about that.
So the problem with these testing is that it's expensive and not accessible to everyone.
Okay.
So there is testing. There's definitely very good testing. It's stool testing, where you can see what bacteria do you have, which one do you lack.
Yes.
And that is helpful. But then maybe for the majority of our viewers who doesn't have access to this testing, by going through basic principles. The one would be to reduce the stress in your body. The next would be to move. When you're moving, when you're going for a walk every day, your body uses up all those bad hormones, which exacerbate stress. And that's the best way to manage your stress, is to sleep better, to move, to meditate, and to be very cognizant of everything that you put in your mouth. More prebiotic foods, to be very careful. Even things like Tylenol and Advil, I used to think that it's not harmful to just pop Tylenol or Advil when you need to, but it is harmful for your gut. So to be very cognizant of everything that you put in your mouth, and to know that it has lasting effects.
Yes, amazing. Wow. All right, so we've spoken about gluten can be one of the things. What are the others? Like, I know we always used to talk about inflammatory products, so sugars, things that cause inflammation. Let's talk about that.
Yes, that's a big one. So actually all sugar, and I know it's hard to ditch sugar, and people always first ask me, how about sweeteners? But then, so there's different things about sweeteners. The one thing about sweeteners is when you do take sweeteners, your body thinks food is coming. So it still secretes insulin. So you still get insulin resistance, and that's that fat layer around your stomach. But then, so for multiple things, sweeteners are not then good, because it secretes insulin. You're higher risk of developing diabetes. You're going to get more abdominal fat. Your body thinks food is coming. So you're more hungry, so you're more likely to consume more calories during the rest of the day. Your taste buds get upregulated to be used to a more sugary type of thing. Easiest answer is really to just cut back on sugar. If you crave something, rather eat something fatty. So oils, things like Brazil nuts, walnuts, will often satisfy that craving that you're having.
So wait, those oils are kind of not like Timbits and like donuts. Oh, shame. I was thinking oils, like, okay, we got you, doctor.
No, we're talking about all the healthy oils.
Okay.
and those are your most...
Avocado.
Yes, avocado.
Okay, I got you.
And those are your most harmful oils, the oils that cause this leaky gut, would be the processed oils, the type of oils that you get fast food in. And those are all the food oils that you want to stay away from.
Okay.
So the good oils are oils, cod liver oil, fish oils, nuts, seeds. Those are the oils that you want to increase. Raw olive oil.
Right.
That you want to increase in your diet.
I think the hardest thing for me was when I got my report back, and we were like, yay, there are no major pathogens?
Yes.
Yeah, so there would be things like
a parasite. So some people might have parasites, and I had a client now who had a parasite, But just from, in South Africa, from tap water, where their tap water got contaminated, you know, so that is, you know, you don't even think that you're like in some rural place drinking from a well. It was just municipality tap water contaminated, had a parasite, So first we test for parasites, bacteria, but then after that.
So, and then after that, you kind of, for me, it was just really deciding how I wanted to live. Like, I do not want to be like this anymore. And you are the only person that has the choice to wake up and say, I am going to do this. And it's hard. And I encourage you guys that are watching and like listening to this, because the information is amazing, but it's only amazing if you take it to heart and use it. The day I decided, okay, that's it for me and sugar, we are not friends anymore. And it's going to be okay. And I had to find, actually, because the minute you say no, is it the medulla?
Yes, then you're just craving it. Me the same.
Medulla oblongata. You can't have it. Now I'm like, I'm a rebel. I'm dying. My life is over. I can't have sugar. What do we do?
So, and I'm exactly the same. When I read about the sugar, or I have patients with all these autoimmune diseases, inflammatory diseases, even more cancer because of sugar, when I think, oh, sugar is bad, I'm going to quit sugar, that are the times when I crave it more and when I eat it more. So what I found that's been really successful with my patients, even when we do smoking cessation, alcohol cessation, is not to say no, but to say yes to something else.
Correct.
And that's what I was talking about, those nuts. If you know 10 o'clock at night is when you crave that chocolate, to have nuts ready, to maybe you can soak nuts the day before and then heat it in the oven, lightly toasted. That smell of the nuts, you know, it can satisfy that craving. To go and replace it with a fruit, to have these things in place 10 minutes before 15, so you're not depriving yourself. You're really rewarding yourself with something better. My patients that I help to come off alcohol, I often say to really replace it with that sparkling water and cranberry juice, berry juice, so not to, when everyone is sitting with a drink, to have nothing. But to have your something which is special, which you enjoy, but that you're replacing. And same thing with healing your gut. To focus on things that's good for you. So before you say you're going to stop all the negative things, make sure that you add good things. Add sauerkraut, add kimchi. These are new tastes that, you know, we're not used to. Add miso soup, add tempeh, add these things to your food. And then only a week or two later, you start cutting back on the negative things.
Yeah, it's a big thing. And I think for me, that sugar thing is a huge thing. Also because I've heard people say, that sugar craving is almost the same as like a cocaine, because it works on the same receptors in the brain or something.
Yeah, it is.
I should be a doctor. I swear. I think I'm going to study again. I love talking with Dr. Daniela Steyn because this is my vibe. Like, I love this. And so I know, like, I would crave so much sugar. It's so bad. Like, I cannot buy it and have it in the house. It's a problem. And I think the biggest thing I had to do was say to my family, like, guys, I need your support. If you guys want to go and eat Timbits or have chocolates or whatever, go do it without me. Go and have it outside where I can't see you, because it's a struggle for me. And to have their support and respect, like, hey mom, maybe try stuff with you, you know, or whatever. But to have their support is key, because you almost feel like you're an addict. Like you it's a big change, guys.
So I have a very good nutritionist, Gina, that has a whole recipe book that's on my website that you can have a look at and download to help you get off sugar. So ideally you should just not have any sugar. But while you go through this process through life, where you want something good, make sure you have something healthier in place. So you can download it on my website, wellnessmdhealth.com, and it's a booklet on sugar with recipes, with replacements of healthier alternatives, so that you still have something. You're not depriving. When your kids do come home with your Timbits, you have your something else that's a healthier
totally divine. And I think you also, there's an element of resentment, like you build up resentment. It's like, how is it that the whole world can eat like this and I can't? And in fact, it's actually not true. Don't do that narrative with yourself, because generally there are a lot of people with leaky gut and they don't realize it. There are a lot of people who are not processing sugars and all the stuff. So the statistics are out there. People are super sick. They are ill.
And people often don't recognize it. They'll come to me with joint pain. They'll say, I don't have a problem with gluten. I don't have a problem with sugar, but I have joint pain. First time I got introduced to that was our chronic pain clinic where I worked in Alberta would put people on a gluten-free diet. And then the majority of people, after 3 weeks of being gluten-free, their joint pains will go away. They'll be able to come off their opioids. And I was so surprised by this, how people can have a completely different problem, but then that problem gets cured by going off gluten. And now I understand it, now that I did more training at Functional Medicine Institute, that it's such an easy fix. So yes, you might think you're good with sugar and gluten, but if you have a symptom, that's such an easy way to address your symptom.
Absolutely. So I think in terms of, you don't have to spend a lot of money. You can use the tips that we've spoken about today, and that is amazing. Like, I want to download all your stuff. Go check those recipes out, because I think that's the other key thing, which for me is the finale of, like, you come through this whole process. Now you've made the decision. If you are not organized, you very highly can fail.
You have to pre-plan.
You have to pre-plan. Like, if you're going to work with no food, you are going to buy something that you're going to regret, and then it's kind of starting from zero again.
Yes.
You have to be organized. So that's my, like,
even
for me,
going to work, working as a wellness doctor, being so aware of all these things. If I don't have lunch at work, and we're not always hungry for lunch, right?
Yeah.
You're only hungry once you come home and but that is when I will eat unhealthy, if I didn't have lunch.
Totally.
So I have to pack that lunch. I have to set an alarm and make sure that I eat my lunch, even if I'm not hungry, because I know that's the right thing to do.
And if you're a sugar user, your body knows to crave the fastest source of energy. You like the thing that you love, you're like, oh my word, I could just totally eat a pie right now and a Tex bar,
So you shouldn't wait for that I can eat a pie now feeling. You should really 4 hours before that I can eat a pie. Eat your low GI food. That's a salad
100%.
and tuna, because no one wants tuna and salad when you crave that chocolate.
No.
So you have to eat it 4 hours before.
Totally.
The other thing we had a lot of questions about was supplements.
Oh yeah, let's talk about that.
Yes. And then supplements specifically to heal your gut. One of the things would be zinc, and specifically also because zinc are one of the first things that your body can't absorb when you have leaky gut. So those people will often be low. Collagen is a very big one. So collagen is what keeps our skin beautiful and young. And then as you get less collagen, that is what causes sagging skin. And you need that same type of collagen for your gut on the inside to be more whole and protective. Easy way to get in collagen, if you do not want to take supplements, if you want to go all natural way, is to take bone broth.
Oh, I love that stuff.
Yes.
It's amazing.
And bone broth has things as collagen in it, which we don't typically eat the joints of animals, but when you cook bones of an animal, you get all those joint cartilage, collagen from the cartilage, you get that into a soup, and that really helps, that soothes your gut.
Yeah, amazing. I actually love that. And also remember, if you are making that, roast the bones before, like a roast them, which caramelizes the fats a lot more, and then make your bone broth. Guys, I'm hungry now.
L-glutamine is another supplement that's very good, and
I've heard about that.
Really helps to heal the gut. And I'm not a big bone broth maker myself, so what people can do who's never done it is you can actually buy a bone broth. So that's not your first price. First price, you're going to cook it yourself.
Yeah, sure.
And if you can get a farm-raised, pasture-raised, grain-fed, or not grain-fed, pasture-fed animal, that's your first choice.
Yeah.
But then plan B is you can also buy it the same way that you get a protein shake. You can buy a collagen powder that you can mix in a bit of a protein shake, and that really helps to heal your gut. You can take that.
Oh, I'm going to do that. I actually don't take collagen. Of all the things that I do, I think I'm on track.
Do
the
collagen.
Zinc and the collagen I don't do.
Collagen is good for anti-aging. We're going to be happy 20 years from now if we did it now.
Okay,
yes,
great. I'm all about that. Good tip, good tip.
Thank you so much for joining us today. Please subscribe to my YouTube channel, subscribe to Andrea's YouTube channel, just put a thumbs up for this video. Please send it to someone that will benefit from this. Have a look at my website. There are so many free resources, things that you can download on my website. Thank you so much for spending time with us.